is Jenny Lauren Dowden for Conduit News. Today, we are joined with Senator Dan Sullivan. He is a friend of Conduit. He's been working very diligently for the fight regarding medical freedom and personal liberty, and we're honored to have him join us today. Hi, Senator.
Hi, thank you. My pleasure, and I appreciate the invitation. And I appreciate the opportunity to speak to the people. You've had several very powerful videos, and I hope people in our state are paying attention and listening to the words that are out there.
Well, a lot of those people that we spoke to are right here in Northwest Arkansas. We are, I would consider the epicenter of where these mandates are happening with the large corporations, Tyson, Mercy, Walmart. What are you hearing around the rest of the state as far as what's the temperature regarding all of this?
Well, I agree you're kind of at the epicenter for the medical industrial complex, but every individual is at the epicenter of this. This is about personal healthcare freedom, and it's not about the medical industrial complex healthcare freedom, but it's about each individual making decisions for them and their family. And I think you hear just as much, or I am hearing just as much anxiety and frustration with the administration and some businesses all over the state. And we did a survey. My campaign did, and I think we're over 2,000 signatures just in 3 days of people who are for medical freedom and oppose these vaccine mandates.
That's great. We are hearing from a lot of people as well. And, one thing in particular, as we're heading into October 1st, November 1st, that is when these mandates will go into effect and a lot of people will be losing their jobs. People are seeing this opportunity with you and the legislators there in Little Rock. The next 3 days, beginning Wednesday through Friday, an opportunity to pass COVID-related legislation. What are you seeing right now at the Capitol?
Well, of course, we have a big rally tomorrow at noon, and it always impacts legislators when they see voters engaged. And people that come to these rallies are voters. We legislators know that. So first, I would encourage as many as can to be there in Little Rock. We have one bill out there, Senator Ballinger's bill. I'll call it a don't ask, don't tell bill. It has been filed. I think there are several other bills floating around, but nothing that I can comment on at this time. But there are a group of legislators who are very engaged in finding a solution to protect healthcare freedom. There's conversations with the industries that you mentioned on opportunities they may have to walk some of this back. So we are quite engaged. We have meetings today, caucus meetings today in the House and Senate, I think, and then we will convene Wednesday at 1. Bills will be filed. On that day, we will start to hear those bills in committee on Wednesday. There's a 24-hour delay, and then we'll hear them again on the floor probably Friday and vote at that time.
What obstacles do you see that may be in the way with getting these bills passed?
Well, one obstacle is, we are coming back from recess. So we really haven't adjourned from our original session. And there are some that are concerned that we can't bring this bill up, or there could be problems if we bring other legislation up that's not related specifically to the language that we recessed under. Again, that you asked about obstacles, that's an obstacle. And there are people with various opinions on whether we can do that. The problem, if we don't do something immediately, is that these October 1st deadlines will kick in. And some people would say, well, wait until after this recess is over and bring it up in a special session next week, probably. The problem with that is it takes a 2/3 majority to bring bills up. I doubt if we can get a 2/3 majority. And what about all the people that lose their jobs on October 1st? So I just don't think we can wait. And although I'm respectful of those that are cautious about bringing up legislation, they feel like there may be a lawsuit filed. I think we're going to have to take the chance. There'll likely be a lawsuit filed over redistricting no matter what we do. And again, we represent the people. We don't represent the business as directly, but we represent the people. And we have thousands of people in our state going to lose their job. And if that means we need to take action now, when we come back from recess, I'm prepared to do that.
Thank you for that perspective. And we agree with you. What do our Kansans need to do to help move the needle as you all are coming back to the Capitol?
Sure, they need to for sure contact their legislators, and folks, I would just be polite and respectful. Legislators that I know are very conscientious about reading emails and responding to text messages. And I try to do everyone from my district, at least, who reaches out in a respectful way. So please be respectful and be to the point. And I'll give you a couple of points that I heard made earlier. So these are not new with me, but we are following scientists, not the science. The scientist we are following is Dr. Romero. And Dr. Romero appears to be unwavering in his position, even as the science changes.
Right.
Early on, as I mentioned, we thought COVID could be spread on surfaces. And we thought all these different things. We had we thought masks weren't important. Then we thought they were. Then we thought they weren't. But as the science changes, the restrictions should be changing, and they're just not doing that. We now know that the vaccine is effective. But we know you can still catch COVID even after being vaccinated. We know you can still transmit COVID even after being vaccinated. We know natural immunity works. We know COVID immunity is very strong. If you've had COVID, that immunity from COVID is very strong. We now have early intervention treatments that we didn't have that makes it not quite as serious. So again, if we're just going to follow Dr. Romero and whatever Dr. Romero says, I just don't believe that's a valid discussion. And science is never settled. Science is always studied. And as the science evolves, then our policies should evolve. I'll kind of close this kind of comments with this. I heard one of the leading doctors at one of our local hospitals here in Northeast Arkansas speak, and very informative, and I appreciate it. But one of the things she mentioned was that what they believed a month ago is not true today. And I'm putting this in my own words, that she talked about the evolution of our policies. And as the science changes, we change. And she said our best recommendation is, and went forward. Well, how can they make a best recommendation when people are going to lose their jobs based on science that may not be true in 2 weeks? That's a powerful thing that we're doing to fire people in the midst of this, knowing that science is ever changing and knowing that we're following a scientist, not the science.
That's a great point. And, we've had several people on Conduit in the past few days. One local doctor said COVID now is 100% political. That, like you mentioned, it's not about following the science. It's not about watching these policies evolve as we learn more about COVID. It's very political. What would you say to that?
I absolutely agree. And it's political. It's the medical industrial complex in Arkansas that is very, very powerful. For example, our medical industrial complex for a decade has been very restrictive on rules and regulations. One of the most restrictive in the nation for advanced practice nurses, for telehealth, for anesthesiology, for pharmacology. We've been very restrictive. So many of the professionals who want to expand their practice leave the state. And that's been going on for a decade. And now we're getting ready to terminate doctors and nurses and other healthcare professionals. And guess where they're going to go? They're going to leave the state also. And Arkansas, once again, will be in a terrible position for the patients and the consumers of our state, because this medical industrial complex that's in league with the Chamber of Commerce and some of our big business are forcing some of our best professionals out of the state.
That's right. And, it's hard to reconcile when we continue to hear our hospitals are overrun, staffing is short, we're in the middle of a pandemic, but then these hospitals and institutions are mandating these, vaccines that will inevitably push, like you mentioned, a lot of these people out of the healthcare profession field. And then in return, we're having to bring in National Guard and others to fill in those spots. It's hard to reconcile and make sense of everything that's happening right now.
Again, we're not following the science. We are just following the scientists. And they are they bought in so much to themselves, they're not willing to have that discussion. And we mentioned just the other day in talking with the Department of Education about quarantining students. And now we know the science in Arkansas, actual numbers in Arkansas say that we're quarantining healthy students who are asymptomatic, not transmitting the disease, and we are quarantining them by the thousands. Now, do you think after learning that, the Department of Health would change their policy? Not one bit. They're still quarantining students at the same rate, but in order to get around that, they just quit inspecting the schools. They're going to stick with their guidance, but they just will not go into the school to check to see if the schools are following the guidance. In fact, there's a letter circulating asking parents that if their child is quarantined, to take this document to the school and ask the school to provide evidence of who witnessed it, what the distance was, what time it happened, and is the school following all the guidance. And we're finding some schools refusing to provide that information to the parent. Again, it's not about following the science. It's about following a scientist who is in our administration that is stuck and afraid to say it's time to change. It's time to change our businesses. It's time to change in our schools to do what's best in the best interest of our citizens of our state.
And we have that form on our website, and I'll
Oh,
add
good.
a link for anyone who's interested. One last thing before you go, what would you say to these employees and Arkansans who are coming up on this October 1st and November 1st deadline? What would you want to say to them?
Well, first, thank you. I've been through a job situation in a similar manner where I had to choose between whether I would follow my conscience or whether I'd follow the job. And I chose to follow my conscience. It meant that I had to take almost a year off and go back to school and be re-educated for other jobs. But I tell you, I've never regretted that day when my employer said, Dan, are you going to follow your conscience or are you going to do what we're telling you to do? And I decided to follow my conscience. So first I thank them. We need more people. Freedom, as we've said, is not free. There's a sacrifice to be made. And I think all of us should be thankful for the people who are willing to stand up and follow their conscience when it really impacts their family in major ways. And we need to be helping them. So I hope we in Conduit will probably be a leader in this, that we can help those people who are experiencing these difficulties. We can, as a group and citizens of Arkansas, help them through that.
Well, thank you so much for joining us. As always, it's a pleasure, and we appreciate all of the work that you do.
Thank you, and I hope to see people tomorrow at noon.
That's right. We'll see you there. Thank you, Senator.
Thank you.